Does your sinus pain feel like this, as if you had nails in your head? Where did we find this picture?
That's us today. That's a
Definitely is. Well, sinus pain, though, is no laughing matter, even though we're giggling. And many of us suffer, though, from chronic sinus problems, which is even worse.
Yeah, but there is new technology that could help bring relief, and we're going to talk about it this morning. Dr. Madan Kandula is back from Advanced Ear, Nose, and Throat Specialist, and we're going to talk about one new method of treatment. It's called Balloon Sinuplasty, and we're going to get to that in a moment. Good morning to you.
Good morning.
Thanks for being here. What is sinusitis? Because there are a lot of people who have chronic, what they would probably consider as chronic sinus problems. Is that the same thing as sinusitis?
Yeah, it is. I mean, there's sinusitis. All that means is there's inflammation within the sinus cavities, and it's kind of a vague spot because they're hidden away. So there's 4 sets of sinuses around the nose, and when you get inflammation in there, that's sinusitis.
And can that be caused by a variety of things? Like, I think about allergies, I think about colds, infections, those kinds of things. It's not any one source, probably,
right. I mean, technically, sinusitis could be any one of those things, but what most people really think about as sinusitis is a bacterial infection that either is coming and going or just never going away.
And how do you know that you have sinusitis versus just a cold or allergies or something else?
It can be, it actually sounds like a simple question, but it can actually be fairly challenging. So really, if you've got a cold or allergies, then a cold should come and go without really any residual side effects. Allergies should be, you should be able to treat those with allergy medicines, and you should be feeling great. If you're not doing either of those things or not feeling like you ought to, even when you're doing all the things you think you need to be, then there might be something else going on.
So let's talk about then how it was treated in the past. If someone came to you or a doctor and said, and you determined that they had sinusitis, how historically has that problem been treated?
Well, really, up till now, it was really antibiotics or medicines like that to really try to get rid of the infection if that's there, or traditional sinus surgery, which what that is we're looking in the nose with a camera, opening the sinus openings up. With traditional surgery, we actually have to remove tissue to do that, and those are the 2 options.
And did that cause more inflammation sometimes?
Sometimes. I mean, usually, there are people who still need that need us to do that sort of thing, and it does work well, but there are a lot of people who need help beyond the antibiotics, beyond medicines, but aren't quite up to the level where they need sort of the more aggressive surgery, and that's where some new options really help.
And one of those new options is balloon sinuplasty. What exactly is that?
It really is. All the sinuses have little openings into the nose, and all we're doing with balloon sinuplasty is expanding those natural openings. So we're not removing any tissue, we're not doing anything into the sinuses themselves, but we're actually just keeping things open.
This is an animation. Will you walk us through it?
Sure. This is showing the sinus, so it's kind of hard to see. Those 2 black spots are the eyes there, and where that little device is up in the sinus is up in the forehead. So put the wire in, expand the balloon, all that stuff comes out, and you bring everything out. So that's it. It usually takes just a few seconds to do.
And not super invasive either.
No, it's it's as minimally invasive as you get.
What about recovery with that procedure?
It's very low key. A lot of times I do that in combination. It's really the whatever is the most intense is the most limiting step. But with this, people are back to work the next day with just sinuplasty.
I was just going to ask, because that's quick. That's really quick. What about the results? Are those the results for just about anybody who goes through balloon sinuplasty? Yeah,
I mean, it depends. Everybody's different, so everybody's got their sort of different issues. But yeah, I'd say as far as new options, new things that we can do for people, this has been really the biggest advance for sinus sufferers for the last 20, 30 years, which is big news.
Well, one of the things I've always heard, no matter what type of procedure you're going to have done by a doctor, is check with that doctor to see how often they perform a particular procedure or treatment.
Sure.
Is this something you're quite familiar with, or is it so new that you're not doing a lot of them at this point?
I was the first one to do sinuplasty in the state of Wisconsin. I've been doing it for over 2 years now. And yeah, I mean, this is what I do day in and day out. So I would agree. I mean, it really is important when you're seeing a physician who's especially going to be doing a procedure that you're comfortable, that they're confident, and I'm confident.
So you were the first doctor here in Wisconsin to be trained in doing this procedure. So how many procedures have you done? Because you have to be the most experienced in this entire state to do this.
Yeah, I am. I've done hundreds. And so it kind of keeps, each week I probably do 10 to 15 of this sort of thing. So the numbers kind of add up pretty quick.
And I'm sure people are seeking you out outside of the Milwaukee area because you are the most experienced in the entire state, too.
Yes, exactly. We've had people from actually Michigan, Illinois, all over the place kind of coming in and
That's a big deal, doctor. Yeah, that's fantastic.
Yeah, and the thing I wonder too with this is it's probably something you can try, and if for some reason it doesn't work, you can go back to that more traditional type of sinus surgery.
Yep.
So this can almost be a first line of defense, and if people get relief that they're seeking, especially because it's minimally invasive, then they don't have to go to that more drastic surgery.
You got it. I mean, that's exactly what I say to people, because it's an in-between option. We don't burn any bridges. We can keep doing what you've been doing, or if things don't really work out like we want them to, we can always move up the ladder. But yeah, there's really not much of a downside to it, which is great.
Nice option. Now you have a free seminar coming up where you're going to answer people's questions and talk about, I like this, the sensible choices, looking at how some of these new technologies can benefit people, and it's going on Tuesday, May 20th. That's next week at 6:30 at the Crown Plaza Hotel.
Correct. Yep.
Okay, so people should just call the phone number that's on the screen and kind of make a reservation.
Exactly. Okay. Yeah, and it'll be just a speaking event, and I'll answer any questions anybody has, and it should be a good time, hopefully.
Nice. And here's the information for Advent Advanced Ear, Nose, and Throat Specialists. They're located in Wauwatosa on Mayfair Road. For more information, you can call 414-771-8780, and there's also a web address there. Thanks for being here today.
Thank you for having me.
It's nice to see you.
Yeah, and coming up, preparing for retirement and beyond.
But first, will you be like this woman, 86 years old?